SMBG is self-monitoring of blood glucose. Home monitoring of blood sugar control is very important for those patients even on the diet control, those who are on the oral medications, and obviously those on insulins would require a regular sugar monitoring. We as endocrinologists, we as physicians do trust most international branded glucometers as a reliable way of testing the glucose. And it has all been tested and approved by the international agencies. Yes, there could be some variability in the blood sugar reading, but we are not diagnosing diabetes based on glucometers. We are just relying and titrating your treatment based on the sugar monitoring. If it is properly done at the right place and as advised by a doctor, it can be really great help in controlling controlling the sugar. HbA1c will have to wait for 3 months time to see improvement, but if you do a regular sugar monitoring at home, it helps us to guide your treatment. Now, how frequently it should be done? If you are in a diet, if you do your sugar control once or twice a week just to get an idea, it is good enough. If you are unwell for any reasons, you can do it more frequently. If you are on medications like metformin, where the risk of hyperglycemia is much less, you can do again on an infrequent basis. But once you go on what we call it as class of sulfonylurea medications called glimepiride or gliclazide, because there is a risk of hyperglycemia and you can titrate the medication up, you'll have to do your blood sugars more frequently, fastings, and usually we say 2 hours after meals. And you can have 4 to 6 reading in a week's time. Once you go on insulin, maybe once a day insulin like Lantus, you can do with the fastings and sometimes 2 hours after meal, and we record up to 6 to 8 reading or 10 readings in a month is good, but your doctors may advise little less or more. But once you are on twice injections, the frequency of blood sugars should be more and more frequent, pre-meals, before your breakfast and before your dinner, and sometimes during the day. Once you are on 4 injection shots a day, you'll have to do more frequently, sometimes 3 to 4 times a day. And if you have type 1 diabetes, you'll have to do something around 2 or 3 times a day on a regular basis. If you're exercising, if your health changes, if you're unwell for any reasons, it should always be done, because your blood sugar can vary, can go low or go high. The most important aspect of blood sugar control is to give us an idea, A. B. Make sure you don't get any hyperglycemia. C. We can titrate the medications. And once you get an idea, it will help up on the long term to prevent the complications